Hey guys, what's going on? It's Dr. Ganatra with SoCal Smiles. We're here in our Costa Mesa office, and in this video I'm going to talk to you about Invisalign. Invisalign is awesome. We get a lot of questions from people wanting to learn more about it, wanting to learn what it's all about and how it's processed, and if they're a candidate for it. So the first thing that happens is you go into your dentist and you get evaluated to see if Invisalign's for you. Most of the time, we're finding that 85% of the time now, most of the time when we want to straighten teeth, we can do it through Invisalign, 85% of the time. Mind you, with Invisalign, you're not using any wires, brackets, or any metal. It's really cool because all you really use is something like this. If I can get it open. Here's the top one, and the bottom one. It's a clear plastic aligner, and it has the ability to hold a prescription. It has the ability to hold a tension in it. And I'm going to go over how this works to move your teeth into place. So the first thing we do is make sure you're a candidate for it, and then the second thing is if you are a candidate for Invisalign, we take impressions, like these super accurate impressions of your top teeth and your bottom teeth, and then we take a bite registration, which pretty much enables us to recreate your bite outside of your mouth. And then the impressions, the upper impression, the bite registration, the lower impression, and digital photos of your teeth and your profile and your jawline, all that stuff is then electronically and physically mailed to Invisalign. Invisalign has its main facilities in Costa Rica. So what happens is after we take those impressions, those things go to Costa Rica, and then they look at those and they digitally scan those impressions. Okay, I think we're going to show you an image of what those impressions look like. I think you can see it right here. Then after they scan those impressions, they make a digital animation of what your teeth will look like. It's like a before and after movie of what your teeth will look like after you're done with treatment, which is really cool. Usually with braces, we can't do that. With Invisalign, it's more of a digital thing. It's more of something on the computer that we can digitally scan and make adjustments on. We can see the after picture of what your teeth are going to look like after you're done, which is really cool. So here I'm going to show you what that digital animation or that scan looks like after we send your impressions off to Invisalign, okay? So here's what a digital scan looks like when it gets converted into an animation. Here's a sample set of teeth that we have, and if you can see here, here's some of the teeth that were really offset, and then we run it through, we go through a little movie, and you can see slowly the teeth straighten out. Okay? So after we take a look at this movie and make sure that it's perfect, and make sure that it pretty much goes over all the stuff that we want the teeth to do. We write little prescriptions on the movie. Right here, we write little prescriptions on this thing, and we tell Invisalign, the doctor, your dentist will tell Invisalign exactly what to do with this digital animation, how to move the tooth, if we want one tooth moved more than the other tooth, or if we want one tooth rotated more than another tooth. We will kind of go over that with Invisalign. So here's a scan of the lower arch. You can see all the teeth kind of moving into place. And after we're done, the teeth are all straight. In this particular case, it took 23 aligners, or 23 pairs of aligners. So what that means to you is that you'll get 23 of these top and bottom, okay? And you'll wear a top one and a bottom one for 2 weeks. And you wear it 24/7. At least 20 to 22 hours a day. If you do that, then it will work. If you don't do that, it probably won't work. If you wear it 12 hours a day, you're probably not going to get the result that you want from Invisalign. The cool thing with Invisalign is you wear these all the time and you take them off to eat or drink anything. If you drink something like Coca-Cola or red wine or something, it may get inside the tray and stain your teeth. So You could drink something with it, but make sure you rinse after you drink. If you have hot soups, you probably want to take the trays off before you have the soup because it'll probably warp the tray. So nothing too super hot, nothing too, if you have something that's really colored, that could stain the teeth, but most of the time people can drink most foods with it, drink most beverages with it, and have most soups and stuff like that as long as they rinse afterwards, okay? You definitely want to take it off to eat. So wear it all the time, take it off to eat, and then you put it back on. For instance, 23 pairs would give you about 12 months. You'll do 1 pair every 2 weeks. So you'll have a top and a bottom, you'll switch it out every 2 weeks, and you'll switch it out with a new pair. And then you'll get a new one of these every 2 weeks. You'll probably see your dentist or come in to see us every 4 to 6 weeks. So you don't have to come in all the time, every 4 to 6 weeks depending on what your treatment's like, and then we give you enough trays for you to take home and switch them out every 2 weeks, okay? So after that scan is done, and after we approve all that, we write our clinical notes on what we want with the teeth, what we want the teeth to do. We get the trays back. We'll have your first appointment with us. You'll come in. We'll take a look at this look at the trays, how they fit for you, and we'll give you some instructions on how to wear them. The 2 things that we'll probably have to do with most all Invisalign treatments is place attachments on your teeth and do something that we call IPR. Attachments are tiny little white dots or blebs that we place on the teeth. Certain teeth that we need to rotate or move in certain directions, we have to place these little tiny white little attachments on the front of the teeth. We take them off after treatment, but those attachments kind of help the tray anchor onto the tooth and catch onto the tooth and actually rotate and help the tray move the teeth. Certain teeth need them, not all of them. Sometimes we'll place 2 or 3 on the top and 2 or 3 on the bottom. Sometimes we need more, sometimes we need less. Those are attachments. And then the second thing we do is something called IPR. IPR is when we go in between certain teeth that are really tightly tucked in together, and we just create a little space between those teeth. We create about 1/10 or 2/10 of a millimeter of space before giving you the Invisalign trays. And what that does, it helps move the teeth in place. So it's a really small amount of space that we create between the teeth. Some people need more space, some people need less. Anywhere from 2/10 to 3/10 or 4/10 of a millimeter of space between the teeth to help them move in place. After treatment, there's going to be no spaces left, and after treatment we take off those tiny white little dots or blebs on your teeth that we call attachments. And then after we're done with treatment, we evaluate and make sure that all the teeth moved into the right place where we wanted them to move. If you're happy and if we're happy with them, and if we think that everything turned out the way we want it to, then you're done. We get you in a retainer program. Retainers are, all the new literature coming out now says you have to wear a retainer for a lifetime, but most of the general population is usually wearing retainers for 6 months after Invisalign all the time, and then you'll probably phase into wearing a retainer at night only, okay? So just depends on what stage of your life you're in, when you did the Invisalign, but we want to make sure that those teeth don't move back, and the best way to do that is to wear a retainer after you're done with Invisalign. We can talk to you a little bit more about that after you complete treatment, but a couple key things to remember. Invisalign's awesome because you can eat or drink whatever you want because you take it off to eat. And secondly, usually it's shorter than getting braces done because the way Invisalign moves teeth is a lot different than the way conventional orthodontics or braces move teeth. So that's a really cool part of it. And the third thing is if you're really in front of a lot of people and you're always you have a job that requires you to meet and greet a lot of people, you're not really worrying about the wires on your teeth and the metal and all that stuff. And of course it's not gonna, since you don't have any metal or wires, you're not gonna cut your lips or gums and all that. So great treatment, highly recommend it. If you guys have any more questions or comments on it, please let me know. If you thought this video was helpful and you enjoyed some of the content in this video, please leave me a comment below and let me know what you thought, and I'll be sure to respond back and give you some more information. Okay, hope you have a great day, and hope to see you in the next video.